module, we'll be discussing female reproduction and the menstrual cycle. For most of you, this will be a review since you've had this in anatomy and physiology. In the discussion about the female reproduction system and the menstrual cycle, we'll be briefly reviewing the female reproductive system. We'll be considering the female reproductive cycles, including the ovarian cycle and the menstrual cycle. Ovarian cycle is happening in the ovaries. The menstrual cycle pertains to the uterus. We'll also look at the neurohormonal basis of the female reproductive cycle. We'll consider the effects of female hormones, including estrogen and progesterone, which are dominant in the menstrual cycle, and follicle-stimulating hormone, FSH, and luteinizing hormone, LH, dominant in the ovarian cycle. As far as definitions are concerned, the uterus, fundus, fallopian tubes, and ovaries are essentials of the anatomy. Estrogen, progesterone, FSH, which stands for follicle-stimulating hormone, and LH, luteinizing hormone, are some of the essential hormones at play. As a review, if conception takes place, the sperm and egg meet once the egg has been released from the ovary into the fallopian tube. If the uterine lining is right, the sperm and egg that have been fertilized can then attach to the uterine wall. The opening to the uterus from the vagina is called the cervix. This is a picture of the uterus, again the top being considered the fundus. We also see the fallopian tubes on the right and left opening into the uterus. The uterus is where the pregnancy would develop a placenta and then grow for 40 weeks gestation. Again, the opening from the vagina is the cervix, and you can see both of those there. In the reproductive system, two cycles are happening simultaneously. These are the ovarian cycle and the menstrual cycle. In the ovarian cycle, an egg is maturing. A maturing ovum is there. There are two phases which we'll be discussing. The follicular phase, days 1 through 14. It's called the follicular phase because the follicle is maturing. The maturing egg is called a follicle. And then the luteal phase. After ovulation, a corpus luteum is formed. If conception does not take place, the corpus luteum begins to die off. Hormones in the ovarian cycle come from the anterior pituitary. They are FSH, follicle-stimulating hormone. Which phase do you think follicle-stimulating hormone is dominant in? In the follicular phase. And the other hormone that is dominant during the ovarian cycle is luteinizing hormone. When do you think luteinizing hormone is at its prime? During the luteal phase. It actually peaks, both of them do, at ovulation. We also have simultaneously going on the menstrual cycle. So this has to do with the endometrial lining of the uterus. The ovarian cycle has to do with the ovaries. Menstrual cycle has to do with the uterus. Phases of the menstrual cycle include the menstrual phase. This is days 1 through 6, when a woman is typically bleeding or having her period. The proliferative phase is next. The uterine lining begins to build up or proliferate. Then the secretory phase. What is being secreted? Progesterone is being secreted, hence the name secretory. And then the ischemic phase. If conception does not take place, the lining becomes ischemic, getting ready for the menstrual phase again. Hormones in the menstrual cycle are estrogen and progesterone. Estrogen is responsible for the proliferative phase, where the uterine lining is beginning to build up. Progesterone is high in the secretory phase, making the uterine lining thick and rich, making it kind of sticky, and it really plays a role early in pregnancy in maintaining pregnancy. And we'll be discussing these in several different manners on the coming slides. During the menstrual cycle, we're considering the lining of the uterus, or the endometrium. There are 4 phases. The menstrual cycle, where she'll be bleeding. This takes place approximately days 1 through 4 to 6, depending on the woman. The proliferative phase, where the lining of the uterus is building up. This is about days 4 through 6, depending on the length of her period, through day 14. Day 14 is when ovulation occurs in the ovulation cycle. ovulatory phase, as the name says, secretory. Something's being secreted. It's progesterone. And if you look at that red line there, you see a big escalation during the secretory phase, during days 14 through about 26 or so. This is then followed at the end of the cycle by the ischemic phase. There's lack of blood flow, and the lining starts to get ready for the menstrual cycle once again and the bleeding. So here we have two hormones, estrogen and progesterone. Estrogen is in this bluish color. It is spiking during the proliferative phase. It is spiking when the uterine lining is building up, and estrogen is responsible for that. Progesterone, in that orange color, is responsible for maintaining the uterine lining. It really makes it thick and rich so that it's receptive to implantation if conception takes place. Progesterone has a key role in maintaining early pregnancy. The ovarian cycle is happening simultaneously with the menstrual cycle. But here we're considering the ovaries rather than the uterus. So I try to look at these again as two separate things happening simultaneously. The hormones of concern within the ovarian cycle are FSH, follicle stimulating hormone. So an immature egg that is maturing is a follicle. So follicle stimulating hormone stimulates this. And if you look here, FSH, follicle stimulating hormone, is on the rise slowly but surely during the first phase, the follicular phase of the ovarian cycle. So here you see the ovarian cycle, the purple egg is beginning to mature as a follicle. Ovulation happens at about day 14. If you follow the follicle stimulating hormone with this, which is that kind of orangey line, FSH goes up slowly but surely and peaks at ovulation. LH is another hormone. This is luteinizing hormone. Luteinizing hormone, you can see, goes down at about day 10 or 11 and then spikes right at ovulation. There are actually home tests that are urine tests that can detect an LH surge, and this indicates ovulation is impending. It's going to happen soon. So LH, the surge in LH, marks the luteal phase of ovulation. Here you can see the corpus luteum. So the ovarian cycle looks at what's happening in the ovaries for development of a follicle, ovulation, and then the luteal phase. If there is no conception, the corpus luteum then begins to deteriorate. The follicular phase is the development and maturing of the follicle and ovulation. The luteal phase then, if conception does not take place, the corpus luteum dies off. Again, the hormones at play here, FSH, follicle stimulating hormone, dominant during the follicular phase when the follicle is developing, and we see that it spikes at ovulation. The luteal phase then is the second half of the ovarian cycle. LH, luteinizing hormone, surges just at ovulation, as I mentioned. The luteal phase is the second half of the ovarian cycle. Here again, it's easiest if you look at these as separate cycles, the ovarian cycle being one cycle happening, and the menstrual cycle, the bottom drawing, being another. So if we start at the top, we have the anterior pituitary, which is responsible for the release of FSH, follicle stimulating hormone, and that's exactly what it does, stimulates follicles or immature eggs. And it also produces LH, luteinizing hormone. So at the beginning of the woman's cycle, day 1 of the cycle, if you look at the middle diagram, what's going on in the uterus is she's currently having a period. So she's starting out a new cycle. So while she is bleeding, and that's coming from the uterus, she is also maturing eggs. So we have an egg maturing here. At about day 14, ovulation takes place. If she does not become pregnant, you see, looking at the top diagram, it begins degenerating. The corpus luteum begins to degenerate, getting ready for another cycle where, again, there would be a follicle that matures. She ovulates, and then, again, if it's not fertilized, begins to just kind of die off. There is an LH surge, looking at the hormones again, about 12 to 24 hours prior to ovulation. The LH surge is what some at-home ovulation indicators look at for people who are trying to get pregnant, is they look for that LH surge. So you'll see FSH very dominant in the first part of the ovarian cycle. LH dominant again right before ovulation to a little bit after ovulation with the corpus luteum. What's going on as far as the menstrual cycle is concerned? We have estrogen very dominant if you look at the middle diagram, very dominant at the beginning of the cycle. Progesterone later on after ovulation, so it starts just before ovulation and then peaks. Progesterone's role is to make the uterine lining very rich and thick, so that if a pregnancy does take place, if the egg and sperm do meet, the lining is ideal for the pregnancy to attach to the uterine wall. Estrogen is peaking kind of right after the first week if you're looking at the diagram. What we have going on in the uterus for the menstrual cycle, looking at the bottom diagram, we have her having a period approximately days 1 through 6. This matches up with the follicular phase. The proliferative cycle then comes next in the uterus. Again, that's where the lining is really beginning to build up, hoping that a pregnancy is going to take place. The secretory phase then, what's being secreted? Progesterone is being secreted. Also during this period, estrogen is pretty high. And the secretory phase is right after ovulation if you're looking at what goes on with the ovaries. The ischemic phase, if pregnancy has not taken place, begins, and she would have another cycle if no pregnancy has taken place. So again, it's important to kind of look at these separately, but they are going on simultaneously. So really try to study this. What's going on with the hormones? FSH, LH at the ovarian level, and estrogen and progesterone at the uterine level for the menstrual cycle. This concludes the female reproduction and menstrual cycle lecture.